So we've had two high power talks. One, all the technology for diagnosing autonomic dysfunction. Other, the wonderful work from lab to the clinic about hot water epilepsy. Both of these make India proud in different ways. Now I bring you back to the land of the bullock cart on how we look after our patients and some new ideas that we have been experimenting with here in Chennai. Just to remind you that we have a growing burden of elderly in India. And currently we think there are 125 million elderly in India. By 2026, we expect that number to be 173 million. So it's a very significant number of older people that we have. And of course, do older people have autonomic function problems? Yes is the answer. We don't have the prevalence of autonomic dysfunction, clinical autonomic dysfunction. But if you look at two particular conditions where it is a big part of, look at diabetes, the International Consensus Toronto panel report said that 20% of all people with diabetes have clinical autonomic dysfunction. Now this, of course, makes it a very big public health problem because we have one privilege, which is that we are the diabetes capital of the world. So we need to think about this. And of course, in Parkinson's disease, in surveys, 50% of 140 people with Parkinson's disease surveyed had clinical autonomic dysfunction. And as you know, Parkinson's disease, while not an extremely common disease, is a very important neurological disorder of the elderly. And if you then pass on to look at people with cardiac conditions, gastrointestinal conditions, you name it, autonomic dysfunction is perhaps a very important part of all those conditions. We don't ask for it, we don't measure it, we don't try to evaluate it because it's the silent nervous system and we are also silent about it in our minds. We've not been thinking so much about it, which is one reason why we organized today's symposium. Now, non-pharmacological therapy is obviously important because for two reasons. One is drugs are costly. Second, in people who are already getting older, it's very hard to go on and on prescribing newer and newer drugs. So we must think of other ways of getting people better. Education is obviously very important. Teaching people about the pathophysiology, teaching people about the prognosis of autonomic dysfunction is extremely important. Water, as Professor Matthias told you, 2 glasses he showed you. So more water is very important for people with orthostatic hypotension or people with vasovagal syncope. Important to remember. Exercise training is shown to increase blood volume and to modulate baroreceptor function. So that's very important. Isometric muscular contractions, you'll probably see this in his oration, but there are particular postures that people can take. For example, this compresses the muscles and provides additional cardiac output. So that is very important for treating orthostatic hypotension. It's important for treating vasovagal syncope. Tilt training is very important, and places where tilt training is available, it can be done. It requires people to go to hospital. It requires that the hospital has the equipment. In Chennai, I only know of 1 or 2 places that have the equipment, even to do testing, let alone do treatment. So that is something that we have to keep in mind. And of course, compression of the abdomen and compression of the abdomen and legs using tight stockings, something like what we do for varicose veins, is thought to be helpful in terms of returning greater cardiac output and therefore preventing orthostatic hypotension. Let me take you to another thought process. As like you, I am a physician, like most of you. I've sat across tables, used couches to examine patients. I have prescribed for them. I've carried out tests in them. But over a period of time, I've also understood that there's only so much I'm able to offer them. I can modulate their medication. I can give them suggestions. But there's very little I can do to make them follow my suggestions, point number 1. There's also very little I can do personally to get them back to health, apart from prescribing and suggesting that so many things ought to be done. This is where the whole idea of comprehensive care comes into play. It's 360-degree care, which is aimed at people with chronic disease. And this is something that Professor Satish Chandra will agree. We've experienced, for example, with conditions like epilepsy, where a whole team looks after the patient, not just the doctor alone. This is applicable for a range of neurological disorders, a range of general medical conditions. In fact, any chronic disease will benefit from comprehensive care, because certain aspects of the disease are not going to go away and people need to be rehabilitated. Introducing it early on in the course of an illness, taking it from hospital to clinic to home, all these things are extremely important and we need to think about it. And in neurological disorders, comprehensive care is very important because most patients with a neurological disease are left with either static disability, I've had a stroke, I'm left with residual hemiplegia, I'm left with residual difficulties in speaking and so on and so forth, or with progressive disability. For example, very few people go through Parkinson's disease without becoming more and more disabled. It's true for many other conditions. Disability is a big part of diabetes as the complications develop. Disability is a big part of heart disease as people find it difficult even to climb one flight of stairs over a period of time. Disability is a big part of many medical conditions, and we ought to think about it therefore. And what we felt needed to be done was to bring under one roof a host of treatments. In the old days, we started off by bringing together physiotherapy and counseling and nutrition along with the doctor under one roof. Then I started getting patients who would come and tell me, because I practice both neurology and psychiatry, they'll come and tell me, oh, I went and did this 21-day Ayurveda program and I am feeling so much better. Okay. Or they would come and say, I started doing yoga and ever since I started doing yoga, I am feeling so much better. And in the beginning, I thought to myself, I think which most of us do, since we don't understand this, is some mumbo jumbo and the fellow's fallen for it. And this was the thought process that used to go through my mind. Later, I started thinking that maybe there is some truth in this. Maybe there is some benefit that people are getting out of these treatments. And which is when we started looking at it a little more carefully. And our first experiment was to start a primary care clinic, put in a family physician, physiotherapy, counseling, and put in an Ayurveda room with Ayurveda therapies. And this we did about 5 years ago now as a pilot project. In fact, it was all so unplanned that I just rented a house near my own home. I had whatever spare money I had in my bank, I used it to just set it up. I didn't even think how am I going to pay next month's salary. So it was completely not thought about at all. What was interesting in that pilot project was that over a year it became very clear nobody in that area will come and see the doctor we've put there. For the simple reason they have their own doctor who may be 10 kilometers away, but they want to go see their own doctor. Nobody in that area will use the clinic for anything else, but they will all use it for therapy. They will come and say, I'd like to have a massage, or I will take physiotherapy with you. My daughter needs counseling, and so on and so forth. Can I see the dietitian? That people are willing to use it for. This was the lesson that we learned very early on. And that was what led us to develop these TriMed centers. Over a period of time, what we have done is to bring many treatments under one umbrella and to put, like in medicine, we have best practice models, we have protocols. We have basically put process to what we do. And we have protocols with which we work. I won't dwell on this because of shortage of time, but just to say that the whole field of complementary and alternative medicine is not that uncommon. The problem in our country, like many things, it's unregulated, but it's not uncommon. The second thing I want to say to you is that in the United States of America, today there are 15 departments of integrative medicine in universities. So we are talking about university departments that have been started to research integrative medicine. So it's quite interesting that they are thinking ahead of us and they are using things that we actually have access to and we are not using. And I think that is something that set me thinking when I went to the US last. We have a great tradition of mind-body medicine in India, in Ayurveda, which has been described as an extraordinary tradition with yogic spiritual traditions. And we have this, within that, we have this very unique, what today the West is trying to popularize. They're talking about personalized medicine. We've thought about personalized medicine for centuries. We've always looked at the individual, We've always looked at what is that individual's constitution, what is that individual's, what's right or wrong for that individual, what are that individual's habits, and then decided to look after that individual. So the West is talking about personalized medicine, which is a little bit designer in the sense that today personalized medicine means I'll also tell you your, what you call it, your genome, what your genome looks like. So they're taking it to another level. But we've always had this tradition of personalized medicine in us. And we know also from the research that's available, I will not dwell on this, that the practice of yoga, for example, which is uniquely Indian, has got a number of benefits for the human body. It decreases cortisol levels, it stimulates your immune system, it controls blood pressure, it increases melatonin to promote sleep. So we know that the traditions that we have do a number of very good things for our patients, and it has the potential to help medical conditions like epilepsy or psychiatric disorders, stress, and so on and so forth. We know all this. Here is a VHS psychologist slide provided by Dr. Subbulakshmi doing a number of yogasanas. Again, due to paucity of time, I'm going to just move quickly through this. So when in TriMed, what we have tried to do therefore is to put together a process of 10 different treatments, all being available under one roof, all as support to allopathic medicine. So the family physician is at the fountainhead, and we have all the other doctors and all the other therapists working alongside the family physician to deliver care to a patient. So the team in every center includes, apart from the family physician, Ayurveda doctors, naturotherapy doctors who also practice yoga, physical therapists, counselors, a nutritionist who goes across the centers, and then we have male and female therapists who actually deliver the treatments. They use water, they use oil, they use mud, they use a number of substances. We put in a process. So what happens when you come in is you're seen by the whole team. That's part of our triage. They take about 3 hours to do this, and each person has an opinion about the client, that this is what is wrong with you. That opinion gets integrated into a kind of therapeutic program, which is then shared with the client. Every center works like a daycare hospital. So people are then given a prescription. Why don't you have the following treatments for X number of days by coming in every day? So people are not disrupted from their daily life. They don't have to go and stay in a hospital. And yet it's all happening under the umbrella of a family physician who understands medical science and medical process. And safety and quality, these things are very, very important to us. We address a number of medical specialties today, and we have programs that rehabilitate people from disability. We have programs that restore function, like for example, a frozen shoulder or a bad knee can be brought back to good function. And we have programs that just rejuvenate and make people feel better for those who prefer to have such treatments. So over 4 years, we've looked after over 4,000 patients. In the last year to 2014, we had 1,500 patients walk through our doors, which is not an inconsiderable number. Each patient took a median number of 9 treatments. So that's a fair number of treatments that have been delivered in a year's time. We've had 125 doctors share patients with us in this period, and many of you in this room perhaps have been part of that. And I'm very happy to say, and that makes me happiest always, 25 or 30 of those are doctors bringing themselves, their spouses, their parents, or their children or grandchildren. And that makes me very happy, because that to serve the medical profession and to have the trust in the medical profession is perhaps most important for any treatment. That's when it gets most rigorous, close look at by people who know something about what is being done. So multiple interventions with a focus that will improve activities of daily living and quality of life. And let me quickly share with you how we have used that in an older person with autonomic failure, which is relevant to the theme of the discussion today. So this is a 66-year-old school headmaster who comes from down south. He came with a complaint of frequent falls while standing, and he feels well as soon as he lies down. And this started in the middle of 2013. As a consequence, by the time we saw him, for 12 months, he was avoiding standing altogether. He was lying down most of the time. And you can imagine that confers a considerable amount of disability on any individual. If you can't stand up, you have trouble. He had a lot of body pain, he had trouble swallowing, and he was moderately dependent on his activities of daily living. He has had a history of generalized seizures in the past, which were under control with treatment. He also had a history of depression, which was controlled with treatment. He had been put on thyroidazine by his GP many years ago, and who had advised him not to go off it because he was worried that he would relapse. So he continued to take thyroidazine for years and years and years. On examination, he had normal higher functions. His speech when he came was slurred. He was unable to stand due to severe giddiness. And when we took the BP, lying down was 100/80, standing, systolic was 50, diastolic could not be recorded. So no wonder he could not stand. It is very obvious that this is an individual who is going to have great difficulty standing. He had no focal neurological deficits apart from the extrapyramidal symptoms and a little bit of stiffness that I was talking about, limb rigidity I was talking about. He had been extensively evaluated by a cardiologist who's got an autonomic lab and was confirmed as having severe autonomic dysfunction. Okay. He was prescribed midodrine by the cardiologist, which is, according to Professor Matthias, level 2. We start with fludrocortisone to improve the blood pressure in somebody with orthostatic hypotension. Midodrine is thought to be level 2. So in case fludrocortisone doesn't work, then you move to midodrine. It's quite expensive, I'm told. It's also not available in a number of places, I'm told. He was on levodopa, controlled release, oxcarbazepine, extended release, the old prescription of thyroidazine, and of course he was on clobazam, frisium, which Professor Satish Chandra has talked about, to prevent his seizures. What we offered him, first in hospital, because this was a man who couldn't stand up. There's no point bringing him to a day clinic. So first in hospital, then at home, and then finally in the day center, was a physiotherapy program that included electrotherapy, passive mobilization, postural exercises, gait and balance training, and then finally active exercises. So he was slowly taken from exercises lying down to exercises standing up and taught how to stand up safely. He had acupuncture with very specific parts involved. He had a mud pack because of his GI dysfunction and his pain. He also received relaxation exercises and some motivational counseling, because people lose confidence once they lie down and they need confidence to get back on their feet. One of the reasons why a lot of our patients stay lying down or on wheelchairs is because they don't have the confidence to walk. It's very important to bring back that confidence. With treatment, pain subsided, stiffness reduced. He was able to walk for about half an hour. He's able to walk and climb stairs independently now. His BP has also improved. And I think what we'll try and do is show you a video, if this will play. What audio?
Stand up. Enrico. Nimun telungu papa. Prayer nimun telungu. Stand straight. Mutti nemtukuma. Okay, mego ukarna.
So as you can see, he is gone from lying flat on his back, which we don't have a video of and which is not particularly exciting to show anyway, to standing with difficulty and support, and finally now walking and climbing stairs, obviously with somebody supporting him a little bit, but on the other hand, it's a huge change for him. So I was very pleasantly surprised to see him walk into my room 1 year later, being quite mobile, in fact 6 months later, being quite mobile and being able to do a lot of his activities of daily living. This is therefore somebody with autonomic dysfunction, severe orthostatic hypotension, who has improved with both midodrine and therapy. Now, did midodrine get him better? Did therapy get him better? It's the $1,000,000 question. But I have one conviction in me: if he had just given him the medicine, he wouldn't have developed the confidence to walk. And I think that what is very, very important, therefore, is that we do consider combining non-pharmacological approaches with pharmacological approaches. So our way is modern medicine-led. It's comprehensive. It incorporates the richness of many traditions, and we look at improving quality of life and improving activities of daily living. If you wish to talk to any of our staff members, we have a few people here who will be outside, and they'll be very happy to share their experiences with you. When we reviewed our outcomes, 95% of people with taking these type of treatments actually get better. It's only about 5% who report no change from the time that they start a treatment. And we feel, therefore, that there is great potential for modern medicine practitioners to leverage on what exists in our own tradition. And my wish is that this should not become one other case where, like Basmati, somebody in the US patents it. You know, you will find that Ayurveda and yoga has been patented by somebody in the US, and then you have to pay them in order to use it. It's not a very nice thought. So I would think that all of us should take an interest about what is possible in our own system. Let me leave you with Peter Drucker, who famously said, the best way to predict the future is to create it. We have older people, a growing burden. We have to help them. And with our pills and with our surgeries alone, I don't think we can do it. We need to do much more. And I think comprehensive care is perhaps going to be one of the answers. I will not say it's the only answer or the most important answer, but certainly one of the answers. Thank you so much.